Examination of a diabetic patient. General examination. The cardinal symptoms of diabetes, severe polyuria, polydipsia, and weight loss, will be present in almost all patients of diabetes. If a patient presents in the emergency, a history of presence of these symptoms must be taken. Patients with acute hyperglycemic crises are frequently severely dehydrated, with hypotension, including postural hypotension, tachycardia, dry mucous membranes, and reduced skin turgor. Fungal nail infections, particularly of the feet, are the commonest forms of infection in diabetic patients. Staphylococcal skin infections, such as pustules, abscesses, or carbuncles, are also seen. Necrobiosis lipoidica diabeticorum is a rare complication of diabetes, predominantly seen in young women, aged 15 to 40 years. This presents as a painless, red macule, usually over the anterior shin, which then heals, with scarring, to form a yellowish or brown lesion. Diabetic dermopathy is characterized by brown macules on the lower legs that heal to form atrophic, shiny white scars. Granuloma annulare comprises pale, shiny rings and nodules, usually seen on the hands. Villosus diabeticorum is characterized by tense blistering, mainly on the feet. Vitiligo is seen in a small number of patients with type 1 diabetes, reflecting its autoimmune nature. Acanthosis nigricans is characterized by a dark velvety appearance in the axillae or neck of people with insulin resistance, and frequently accompanies type 2 diabetes, but may occur in people with insulin resistance in the absence of diabetes. Diabetic patients treated with insulin should have their injection sites examined for signs of lipohypertrophy or lipoatrophy. Lipohypertrophy is a physiological response to insulin injected in fat cells, and lipoatrophy is an allergic response to non-human insulins, which is rarely seen nowadays. Diabetic cheroarthropathy, or stiff hand syndrome, or limited joint mobility, is seen in some patients with long-standing diabetes. It is characterized by skin thickening and sclerosis of the tendon sheets, leading to reduced joint mobility and the characteristic prayer sign. To examine the hands, for carpal tunnel syndrome, the presence of Tinel's sign and Phelan's sign should be sought. Thenar eminence wasting may also be seen. Feet of patients with diabetes should be examined thoroughly to look for wounds or deformities. Callus, a sign of excessive pressure and fungal infection, especially between the toes, nail care and ulceration, should be carefully assessed. Peripheral pulses and nail fold refill should be assessed for signs of peripheral vascular disease. Nerve function is assessed by testing vibration sense at the great toe, medial malleolus, and knee, and testing fine touch on the toes, metatarsal heads, heels, and dorsum. Loss of ankle jerks is also a sign of early diabetic peripheral sensory neuropathy. Charcot neuroarthropathy is a complication of diabetic peripheral neuropathy. It presents with a painless, swollen, hot red joint, sometimes with a history of minor local trauma. Untreated, the joint develops severe deformity, which then puts the foot at high risk of ulceration, infection, and amputation. Cardiovascular system examination is important in patients with diabetes. Blood pressure should be measured frequently in patients with diabetes to detect hypertension or postural hypotension. Arresting tachycardia, loss of sinus arrhythmia, and loss of reflex bradycardia during a Valsalva maneuver can indicate autonomic neuropathy. To get more such high-yield medical content, don't forget to subscribe. Visidia Med. The easiest and fastest way to take advanced clinical history.